Welcome to Module 1 of the OCAT Virtual Training Series, Improving Customer Engagement Through Powerful Interviewing Techniques. The Virtual Training Series is designed for staff wanting to refresh their knowledge and skills, staff who are responsible for training or coaching others, and new OCAT staff. The training modules within this series are designed for individuals, but can be used in a group setting by supervisors and trainers to strengthen caseworker skills. Throughout the modules, you will be directed to resources and practice exercises intended to enhance the learning experience. This module will cover a variety of communication techniques designed to build positive rapport with customers, including specific motivational interviewing techniques to gauge customer readiness and opportunities to provide additional customer support. The training is grounded in these guiding principles. Each customer is the subject matter expert of their life and has the capacity to grow and change when they are ready and able. Through positive interactions between the caseworker and customer, both have the opportunity to gain a clear understanding of the customer's circumstances. OCAT is designed to support the caseworker's expertise and experience working with customers. OCAT captures strengths and opportunities that assist caseworkers and customers in working together to develop a relevant and meaningful plan. Another important guiding principle in your work with customers is to strive to be the calm within their storm by working in partnership with them and treating them with dignity and respect. Remember that our customers are experiencing incredibly stressful circumstances. Consider for a moment if you were one of the customers you serve. How stressful and complicated would you imagine your life to be? Now imagine that you have multiple systems or programs adding to your stress with tasks and requirements you may not feel you have the time, energy, or resources to accomplish, yet your ability to pay rent or buy food depend on getting the tasks completed. When we pause for a moment to reflect on our customers' circumstances, we are more likely to move into a place of compassion and be more patient. Change in and of itself is stressful, and when added with the level of uncertainty that exists for those living in poverty, the chronic stress understandably takes a toll on physical and mental health, adding to the challenges our customers may face. When we combine the stress of living in poverty with the likelihood that many of our customers also have a history of adverse childhood experiences and/or trauma, we have further compounded the challenges that may get in the way of customers achieving their goals. Let's talk a little more about adverse childhood experiences and how those may negatively affect the adult customer you are working with today. In the mid-90s, the Centers for Disease Control and Prevention and Kaiser Permanente surveyed 17,000 participants on childhood maltreatment, family dysfunction, and current health status and behaviors for a study on adverse childhood experiences known as ACEs. The ACE pyramid represents the conceptual framework for the ACE study, noting how strongly related ACEs are related to the development of risk factors for disease, as well as a person's well-being throughout their lifespan. The ACE study found that ACEs are common, and as the number of ACEs increase, so does the risk for negative health outcomes, including diminished executive functioning skills. These are the skills that help us effectively manage our time, problem solve, regulate our emotions, and initiate tasks, the skills that are critical for your adult customers to accomplish their goals and succeed. While this information may seem daunting, there are several ways in which you can support customers and their resiliency. There are two main ways you can do this. First, use a trauma-informed, person-centered approach when administering the comprehensive OCAT. We'll discuss more about how to do that throughout the training series. Second, work with others in your office, profession, and community to identify a robust resource directory in which you can refer customers as needed. Let's review essential interviewing concepts and skills that will help you build and maintain positive rapport with customers. The customer's first impression and experience with CalWORKs is critical in shaping their perception and expectations about their experience. If I were to walk into your agency, your office, or cubicle, what would I see? What would I hear? For example, are there posters that convey you are there to support customers in achieving their goals? Or are there signs that warn customers of the consequences should they be caught engaging in benefit fraud? In addition to how the environment looks, the people in the organization play a key role in setting a customer's expectation of how they anticipate being treated by the caseworker. Each person's nonverbal communication, from a security guard at the entrance and front desk clerk to the caseworker, matters. Often we are not aware of the nonverbal messages we convey to others, which may include frustration, impatience, or mistrust. As the face of your organization, you not only provide a perception of yourself to the customer, but you inform their expectations of how they will be treated by everyone else within your organization. Now that the stage is set, let's reflect on the verbal and nonverbal cues that go into helping someone feel understood. For this activity, take a moment and remember a time when you really felt heard or understood. On a piece of paper, describe the characteristics of that interaction. For example, did the other person maintain eye contact? And were they sympathetic? We'll give you a minute to write down your list before we proceed. Now we'll talk about specific aspects of communication that can help someone feel understood. Stephen Covey explained that too often humans seek to be understood rather than seeking to understand. When we seek to understand, we strive to really understand another's unique perspective, and in doing so, convey that we care and are genuinely interested in what they are sharing. This requires giving our undivided attention by actively listening and paraphrasing to ensure we understand. It is also important to remember we each come with our own set of biases and opinions about how we believe we may respond to a situation. However, we must consciously refrain from judgment and remember that we are each the experts of our own life. Most of us only share with others what we want to share, and only to the extent we think others need to know. Strive to affirm and not react to customer statements. OCAT helps you ask a variety of questions in order to better understand a customer situation, and one thoughtful, open-ended question could potentially result in a plethora of additional information that several closed-ended questions would have been unable to achieve. To the extent possible, and when it makes sense, ask thoughtful, open-ended questions to gather more in-depth information about the customer. Although the caseworker is the driver of the conversation, the customer should be doing the majority of the talking. To encourage the customer to openly share, refrain from interrupting, talking over customers, or trying to finish their sentences. As difficult as it may be, do your best to prepare yourself to listen by relaxing and focusing on the conversation. Our human mind is easily distracted, so do what you can to minimize as many distractions as possible, including muting the sound on all electronic devices so that you are not interrupted with notifications or calls. Take a moment to consider your ability to effectively listen to others. On a piece of paper, answer the following questions. What gets in the way of your ability to actively listen? How might paraphrasing help your communication with others? We'll give you a minute to write your answers before we proceed. Trust is a critical component to any successful relationship. To build and maintain trust, we must be sincere. This goes back to being genuinely interested in the customer's goals, needs, and concerns. It also means being sincere in helping them to the extent you're able. One aspect of trust is being predictable, which means our behavior and actions should be consistent. Remember, customers already experience a lot of unpredictability in their lives, so aim to be as reliable as possible. Although unexpected things come up from time to time, that should be the exception and not the norm. Anytime we are unable to follow through with our agreements, then we need to take responsibility, apologize, and communicate with the customer as soon as possible about the inability to follow through. Customers also need to be able to trust our ability to effectively help them. Many customers are involved in multiple systems, rely on time-consuming public transportation, and are doing the best they can to juggle their lives. We need to give correct information so that we do not add to customer stress, runaround, and frustration. Do your job to the best of your abilities, and when in doubt or unable, it is important to seek help and be transparent with the customer. For trust to occur, we also need to be open to the customer's ideas, dreams, concerns, and challenges. This also includes being open to their feedback when your help wasn't so helpful, or when they are frustrated and overwhelmed by all they're trying to juggle. Now we're going to talk about motivational interviewing and how it can help you deepen your partnership with customers as you work together. Motivation is the process that initiates, guides, and maintains goal-oriented behaviors. It is critical to performance improvement. The components of motivation include activation, which is the decision to start a behavior like finding a new job. Persistence is the continued effort toward a goal even though obstacles may exist and/or it may require significant changes, resources, time, or energy. For example, ongoing job searches, interviewing with different employers, or pursuing training. Intensity is the level of effort required to pursue a goal, which varies from person to person. It is important to remember when working with customers that pursuing the same job may be more difficult for one person versus another, depending on their individual circumstances. There are different theories regarding motivation. Some theories on motivation state that our motivation is innate and biologically based, serving as a survival mechanism. For example, eating, drinking, and sleeping. However, this theory doesn't account for how many of our behaviors are learned and shaped by our environment and life experiences. Another theory states that people engage in behaviors that help maintain their optimal level of arousal. So a person with low arousal needs may pursue relaxing activities, whereas those with high arousal needs may pursue the opposite type of activities. There are two types of motivation. Extrinsic motivation refers to behavior that is driven by external rewards or consequences. For example, someone may decide to work hard at their job because they want a raise or because they don't want to lose their job. Intrinsic motivation refers to behavior driven by internal rewards, like a sense of pride or purpose. In our work with customers, one of our roles is to identify the gap between the customer's current circumstances and their goals, and then identify what motivation is needed to help them work towards their goals. Take a moment to consider your customers and your program. On a piece of paper, list the various ways in which you or your program can help motivate customers extrinsically and intrinsically. Examples of extrinsic motivation would be a reward, payment, or sanction. Examples of intrinsic motivation could include an internship if the customer enjoys and is motivated by learning, affirmations, and helping customers feel welcomed at the agency. We can deepen our interviewing skills and further our rapport with customers by strategically incorporating motivational interviewing techniques. Motivational interviewing, also referred to as MI, includes specific techniques for supporting customers in moving toward their goals. MI is a counseling approach developed by Dr. William R. Miller and Dr. Stephen Rolnick that originated in the substance use disorder and persistent mental health community. There are aspects of MI that have been widely adopted within human services. In its origin, MI was designed to shed light on and support the customer in choosing to change their harmful behaviors related to their substance use disorder or mental illness. Although some of our customers may suffer with substance use disorders or mental illness, in social services, the problem is more often about the customers experiencing a lack of resources and support. Because of this distinction, we will only focus on a few MI techniques you can use to enhance your interviewing skills. MI is intended when change is difficult but necessary. In other words, when the lack of change would be detrimental to their or their family's well-being. Most customers are facing complex and difficult circumstances that are challenging, if not impossible, to improve on their own without any additional resources or support. MI techniques can serve as a great tool to help facilitate difficult conversations for customers struggling to create change in their lives. By using MI, you can guide customers to choose and commit to change when adequate resources and support are also provided. The premise of MI is that we cannot tell someone how to live their lives. We each make choices based on what we believe is best for us and when we feel intrinsically motivated to change. This is different from the old way of doing business when we typically told a customer what we think they should do. MI recognizes the customer as the subject matter expert of their life, coaches them toward their own goals, and facilitates conversations that help us and them better understand what may get in the way of them reaching their goals. Fortunately, MI builds on essential interviewing skills you already use. It includes open-ended questions, active listening, and summarizing with the goal of building and maintaining positive rapport. Similar to your current approach to interviewing customers, MI is conversational, using a more casual approach to gather in-depth information. MI is also purpose-driven, whereby the caseworker strategically engages the customer in dialogue that drives outcomes. A key principle of MI is that it is collaborative. When customers feel they are in partnership and on the same team as someone, their stress levels lower, they will be more forthcoming, and they will be more likely to reach out when they need help. To be collaborative, we must truly honor and respect the customer's experiences and perspectives. It is strengths-based, focusing on the talents and skills the customer brings that can support their ability to achieve their goals and overcome potential challenges. Finally, using MI supports a trauma-informed approach to service delivery. Given the circumstances our customers have faced or are experiencing now, it is critical that we engage with them in a trauma-informed, person-centered approach. MI supports the domains of trauma-informed care. MI stresses that all interactions with a customer throughout the organization need to promote a sense of physical and psychological safety. This means interactions are free from judgment, disrespect, or attempts to coerce or control the customer. MI emphasizes the critical importance of building and maintaining positive rapport, as well as being transparent, which leads to trustworthiness. A key aspect of trauma is the feeling of helplessness and having little to no control in changing the situation. MI understands this and works to evoke change through dialogue rather than trying to demand change or criticize the lack of change. MI's emphasis on working in partnership with customers is based on the understanding that healing happens within relationships and the meaningful sharing of power and decision-making. MI is a strengths-based approach that recognizes individual strengths and leverages the customer's experiences to help them move toward their goals. MI deepens interviewing, especially when customers appear resistant to participation, defensive, apathetic, and/or their behavior misaligns with their stated goals. MI techniques offer ways to dig deeper and increase understanding of customer circumstances. The positive rapport that occurs with the strengths-based approach of MI can provide a platform for honestly discussing with the customer what may appear to be ambivalence or indifference about participating in activities or working toward their goals. MI plays on intrinsic motivation by affirming what is working and going well for the customer. Sometimes the customer's current circumstances may feel so overwhelming and impossible to overcome that customers are hopeless. In other situations, the customer has very limited experience feeling successful in accomplishing their goals. If a customer says they can't do something, you can respond with yet. By sympathizing with a customer's rationale for their choices, you can use empathy to further rapport and validate a customer's experiences and perspectives. Through all of the above, there is opportunity to strengthen the customer's belief in their ability to achieve their goals, their sense of self-efficacy. The MI techniques we will discuss next will help you and the customer examine their readiness for change. By recognizing change is hard for everyone, we can engage in realistic conversations with the customer about what may get in the way of them making progress toward their goals. MI is grounded in 4 key processes. Engaging is the process of establishing a trusting and mutually respectful relationship. This is based on the premise that you need a connection with customers before you can start talking to them about making changes. Most of the essential interviewing skills we covered earlier are designed to support this process. The goal is for the customer to feel understood. Focusing is an ongoing process of seeking and maintaining direction. This can be done when caseworkers and customers are able to discuss their goals and priorities, and then come to an agreement on next steps. Evoking is the process by which we elicit a person's own motivation for change. Remembering there are extrinsic and intrinsic reasons for change, it is important to work with the customer to understand what personally motivates them. It could be wanting to be self-sufficient, wanting to have a job they love, wanting to provide a better life for their children. Whatever it is, this is where change talk happens, and where we as caseworkers can help customers reflect on their current circumstances and how they may want to change them. Planning is when we work in partnership with customers to develop a specific plan that is relevant and meaningful to the customer based on their self-identified goals and needs. The principles of MI can be used anytime. However, there are some situations in which MI may be more helpful to you and your customer. When customers are struggling to change due to a lack of motivation, MI can be used to help them explore their personal motivation for change. For customers who seem indifferent or resistant to change, this includes customers who may get angry about program requirements. MI is a great way to explore what is really behind those feelings and how you or other resources might be able to support the customer differently. MI can be especially helpful when navigating through the OCAT sections on substance abuse, mental health, and domestic violence. Some customers may be willing to change but not quite ready. Through empowerment and choice, MI can help them move through the stages of change necessary to find their motivation and build their self-efficacy. Before we end, let's cover 2 concrete and easy MI strategies you can incorporate into your interactions with customers starting today. When a customer's actions conflict with their stated values, goals, or agreements, you can gently bring this to their attention by highlighting the discrepancies. For example, I understand you want to find reliable childcare so that you can begin working. However, since we met a month ago, you haven't looked for childcare. Can you help me understand what's going on? Scaling questions can aid you in assessing the customer's buy-in, self-efficacy, and likelihood of following through with a task. Depending on their answers, you can gauge what additional support or further conversations need to occur before action is more likely to occur. Now we'll discuss key takeaways from the module, additional recommended exercises to strengthen what you learned today, and recommended resources available through the OCAT Learning Center. In this module, we explored a variety of nonverbal and verbal communication skills that are key to supporting positive interactions with customers. We also discussed how essential interviewing skills and motivational interviewing strengthen a trauma-informed, person-centered approach, which strengthens rapport with customers. Finally, we covered the 4 key processes of motivational interviewing and specific MI techniques that explore a customer's potential challenges to change. After completing this module, print off the handouts that accompany the module, including the recommended exercises. This activity is to be done with a partner and is intended to help strengthen active listening skills. After completing this module, print off the handouts that accompany the module, including the recommended exercises. This activity is to be done with a partner and is intended to help strengthen active listening and paraphrasing skills. Using the scenarios and MI tip sheet documents provided, work with a learning partner to practice the essential and motivational interviewing skills discussed in this module. As we close today, remember to set the stage, seek to understand, build and maintain trust, be empathetic, and use MI to enhance customer engagement. Thank you for taking this training. We hope it has been valuable to you and helps strengthen your interactions with customers.